Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Nearly 68,000 people in the U.S. will be diagnosed with pancreatic cancer this year, and that number is on the rise. The good news is that the pancreatic cancer survival rate is on the rise too, currently at 13.3%. That's still too low. The WVU Cancer Institute is at the forefront of improving pancreatic cancer treatment and survival rates. Recently, a team of WVU Medicine experts were first in the nation to use cutting-edge endoscopic technology to treat pancreatic cancer. So today, we're talking with Dr. Shailendra Singh, a WVU Medicine gastroenterologist and endoscopist who performed this breakthrough minimally invasive treatment that's giving pancreatic cancer patients hope. Welcome, Dr. Singh, to Live Healthy West Virginia.
Thank you, Mary, for having me on this podcast. And it's a pleasure for me and to talk about this very important topic.
Yeah, and it's exciting, too.
Yeah, it's very exciting.
Yeah. So let's just start with the basics. First, what exactly is this first in the nation EUS pancreatic cancer treatment?
So we recently performed the first in the nation EUS guided microwave ablation of a pancreatic tumor. So it's an endoscopic procedure, minimally invasive without any incision. We are able to locate the pancreas, perform a high-quality imaging of the pancreas, locate the tumor, and precisely burn that tumor. So we were the first in the nation to use this new treatment option.
Okay. What is the current state of pancreatic cancer right now? What are the treatment options?
So I think the pancreatic cancer, as you mentioned, the incidence is rising, right? And by 2030, it will be the second largest cause of cancer-related mortality worldwide. Wow. And I think what is more alarming is that it's increasing in young people, or you quoted a rate of 13%, 5-year survival. I think that's still not good, right? We have to do better and take these rates up as similar to what we have done with colon cancer or breast cancer and the other areas, right? Pancreatic cancer treatment is challenging.
Yeah.
So what we have available is one is surgery. So surgery, majority of the patients are not surgical candidates. Only 10 to 15% of the patients might qualify for surgery. And the reason behind that is one is advanced age or due to multiple comorbidities, surgery which carries high morbidity might not be an option for many patients. And majority of the times when we diagnose these cancers are always at an advanced stage. So in those patients, surgery is not an option. Then we have the chemotherapy, and then we have some advanced chemotherapy now. But the problem with the pancreatic tumor is it's a very immune-resistant tumor. It's seated, it's kind of shielded tumor. Deep inside the abdomen, the pancreas is surrounded by major organs and blood vessels. And these tumors are very fibrotic resistant tumors for chemotherapy or the body's immune system to act.
So what does this EUS MWA treatment bring to the table that it's a more viable option?
Yeah. So now I think we come to the question of, is there any other treatment options available, and what's the technology that can provide us local, precise tumor therapies, right? So endoscopic ultrasound combines endoscopy. Endoscopy has a camera and a light in it. It goes through the mouth, so no incisions are needed. It's very fast, short recovery time. And this endoscopic is a special instrument that has a high resolution ultrasound on top of it. So the pancreas sits behind the stomach and the duodenum. So just going to the stomach and the duodenum, we get these high resolution, high quality imaging of the pancreas.
Wow.
Traditionally, what we have done with endoscopic ultrasound is now we can examine the pancreas if there is a tumor, and this is an accuracy of millimeters. So we can get good quality imaging and we can perform biopsies with the endoscopic ultrasound. What has happened in the last decade is the endoscopic ultrasound has changed into more of a therapeutic modality. It's no more diagnostic anymore.
Oh, okay.
So we have been using endoscopic ultrasound to drain any collections, perform ablation of nerve for patients with chronic pain from pancreatitis, pancreatic cancer.
And what is an ablation?
So ablation is basically is kind of heating the tissue or a nerve fiber to destroy it.
Okay.
So it's basically thermal based or heat based destroy to tumor cells or the nerves.
Kind of burning it off?
Kind of burning it off.
Okay.
And then, so we have been dealing, what we have seen is endoscopic ultrasound evolving more into a therapeutic modality. Mm-hmm. What it combines is minimally invasive, good quality imaging, and access to the pancreas, which is deeply seated, right? With the surgeries, we have seen it's very difficult to access them, but now we can access the pancreas.
And it's minimally invasive.
And it's minimally invasive. Patients can go home same day with a short recovery time. So now I think what's new about this treatment is now we have a new paradigm for treatment for pancreatic cancer where we utilize this endoscopic ultrasound. Now we can access this tumor with a needle and we can burn this tumor like we talked about ablative therapies.
Okay. So the role of endoscopic ultrasound has evolved a lot over the last 10 years.
Yeah, it has evolved. And I think like performing this first microwave ablation, we have been also using endoscopic ultrasound to do radiofrequency ablation, that is burning of the nerve fibers or the tumors as well. So hopefully this provides the kind of evolves into a new treatment modality that can complement the surgery and the chemotherapy treatments we had for pancreatic cancer.
Okay, I know you explained it a little bit here at the beginning, but what can a patient expect if they get this EUS MWA procedure done? I'm assuming they're not going to be awake for this, right?
Yeah.
Okay.
So this is similar to an endoscopy or an endoscopic ultrasound. So patients come in, usually it's a same day procedure. So what we do is when patients get anesthesia and they're sleeping, with the endoscopic ultrasound, we do a good examination of the pancreas. Now, what is this microwave ablation? So it's basically a very thin catheter or a tube that can pass through the endoscopic ultrasound. Now we're looking at the tumor and it is a sharp needle kind of instrument. So we can push this within the tumor itself and using microwave. So what microwave does is it's using electromagnetic waves, and it can increase the temperature or cause burning and thermal effect that can destroy the tumor cells. So this way we are able to very precisely, and we can see this in real time. We can figure out what is our ablation zone, and we can see these tumors being ablated in real time.
So why is this a big deal? I mean, it sounds like a big deal to me, but why is this considered a big deal in the pancreatic cancer treatment world?
Yeah. So pancreatic cancer, as we discussed, the treatment options has been limited. Our survival rates are still not what we want to see. So, and it adds a new paradigm to treatment that can be added to chemotherapy, surgery, and what it does, it performs a local tumor ablation, so local control of the tumor. Now, we are also working on the hypothesis, and we actively doing research in this field. What this can do is also, when we ablate or burn this tumor, it changes the tumor environment. So like I talked about, that this pancreatic tumor is a very resistant, shielded tumor. Mm-hmm. So once we burn this tumor, all these tumor cells will lyse or become dead, and they might release some antigens. So now our body can attack these tumors better. Also, the chemotherapy, which might not be very effective in an environment where there's a shielded tumor, the chemotherapies and other therapies might work better. So this basically what we believe, and I mean, this is an area of active research as well, is that this can convert a cold tumor, which was very resistant to treatment, into a hot tumor where now our chemotherapy can act on it. Also, our body immune system can act against these tumors. Now, I think one goal I like to mention is that with these therapies, what we are trying to do is prolong the lifespan, that is, improve the survival and the quality of life. So I think that's the whole goal. And there has been some recent studies with ablation, using radiofrequency ablation, that has shown that there is a certain improvement in survival among patients who received such therapies.
So this could help. I think this is why it's giving patients hope, right? I mean, this could help bring that survival rate up beyond 13%.
Yeah. So this definitely gives hope to our patients. And pancreatic cancer has been a horrible disease, and that gives them hope against the fight with pancreatic cancer.
Yeah. Yeah. Now, you performed this EUS procedure on a pancreatic cancer patient about 2 months ago. How is that patient doing?
Okay. So we performed this first procedure using microwave ablation of a pancreatic metastatic lesion, renal cell carcinoma.
Okay, and tell me what you mean by that. What is a metastatic lesion and something carcinoma, you just said?
So this as a patient, patient had a kidney cancer.
Okay.
And now, years later, he had these lesions in the pancreas, right? So we talked about it, and we have a great multidisciplinary team with our surgeons, medical oncologists, radiologists at WVU, and we talked about them. So surgery for a small lesion does carry a lot of risk. It's a morbid procedure. So we offered this patient that we can perform an ablation of this tumor very precisely and accurately. So this patient underwent US guided microwave ablation. So we were able to treat this tumor, and fortunately the patient did well. He was discharged same day. And this is a tumor which was PET positive, that was lighting up on a scan to check for cancer. And later that scan showed that this lesion was PET negative. So I think
the cancer was gone?
So I think it will be too early for us to say the cancer is gone. But as I see, I think our goal is control of disease, local control of the local tumor, and improve the survival as much as possible.
At least slow it down.
At least slow it down. So I think we'll continue to follow this patient closely. And then obviously we are looking to see what happens in the long term. But this definitely gives our patients hope.
I bet. I'll bet, because when you just hear when you hear a pancreatic cancer diagnosis, it's really hard to be optimistic, isn't it?
Yeah, no, I think especially as I said, the numbers we talked about 13% is a very rough number. But as I'm saying, most of these patients are diagnosed at the advanced stages where it's involving one of the major blood vessels. And some of them do have a survival of 1 year. Right.
Wow.
So even if you just put these numbers together, if you're diagnosed with pancreatic cancer today, the chances you're going to be surviving at 5 years is very minimal. And for some of these advanced tumor, it's 1 year or 2 years.
And it's usually because it's progressed. It's further. Are there no early warning signs that you might have pancreatic cancer?
Yeah. So the early symptoms are usually very vague.
Okay.
Patients might get some abdominal pain, some...
Here, take your water there.
So some patients might get mild abdominal pain, weight loss. Sometimes patients, if this is close to a bile duct, might get jaundice. And those are the patients that might present early. But still, it's most of the patients that are diagnosed are at advanced stages,
stages.
and they are not candidates for surgery. So that's why it's very important for us to advance all treatments possible, whether it's chemotherapy, radiation therapy, or these EUS guided local treatments for pancreatic cancer.
So what would you say are the major benefits of this EUS microwave procedure?
So I think if we add this treatment can be combined with the standard of care treatments, chemotherapy or surgery. And I think I see the benefits as it's EUS endoscopic procedures. One are lower risk procedures with a short recovery time. The benefit of EUS guidance is a precise therapy locally to the tumor. And then we hope that it creates a systemic response where chemotherapies or other agents or immune therapies can treat the tumor much better. So I think that's really a new, and we'll see how this research and the therapy evolves, but that will be an excellent option for patients in addition to the standard of care treatments they're getting.
So it can enhance the standard of care treatment that they're getting.
Our goal will be adding this treatment can improve the survival. And hopefully next time we talk, this number is much larger than 13%.
Yeah, let's hope so. So those are the benefits. What are the risks?
So there are definitely risks involved with, as similar to any endoscopic procedure. There is a risk of bleeding, risk of pancreatitis, although we are able to accurately treat the tumor. But pancreas is a very sensitive organ, so we have to be very careful that we stay within the tumor itself. Then there is a small risk of bleeding or us causing a hole or a tear, but these risks are much, much lower. Having said that, this should be done in centers that are very highly specialized. Operator experience is very important, and patient selection is a key. So you need to have an entire team of people who are experienced providing these minimally invasive therapies.
So who's a good candidate for this procedure? Like you said, it's not for everybody, right?
Yeah. So good. So the candidates right now we are doing these procedures for patients who are not surgical candidates and are undergoing chemotherapy. So, and then you have to look at the tumor, certain characteristics on the imaging, make sure it's in a safer location, it's not next to a major blood vessel. So what we do is we have a excellent multidisciplinary team, and then we review every patient and then kind of come up with a personalized plan for everyone.
Okay, you did mention earlier that this procedure is used to treat pancreatitis. What other issues has this therapy been used for?
So not specifically pancreatitis, but we have used EUS guided ablation using other modalities, such as radiofrequency ablation. We have treated neuroendocrine tumors in the esophagus, stomach, even in the pancreas. We have treated nerves, like we burn the nerves that carry the pain sensation from the pancreas, and that can be done for patients with pancreatitis or pancreatic cancer. So these are the areas, and then definitely there is a scope that this can be applied to other areas that are adjacent to the GI tract.
So you can treat other organs with this procedure other than the pancreas.
Yeah, so sometimes if the tumor is metastatic to the liver, then, and if we can see it accurately on an endoscopic ultrasound, we will also treat liver lesion. Similar, we haven't done that so far, but it has a potential that we can localize these lesions and precisely treat them. But I think, again, more research and data is needed in those areas.
But there's potential for a lot more.
We can treat tumors. We can treat tumors in the liver, around the esophagus, stomach, around the rectum using the same technology.
Wow. Okay. So I want you to talk about the expertise of the WVU Cancer Institute team and the WVU Medicine Advanced Therapeutic endoscopy team. I mean, because this is a pretty multidisciplinary. Thank you. Sorry. It sounds like a large team too, in addition to being a well-experienced team. Tell us about that.
Yeah. So at WVU Cancer Institute and WVU Medicine, we have an excellent multidisciplinary team. So every week, we have a team of pancreatic surgeons, surgical oncologists, medical oncologists, pathologists, radiologists, and us. We will meet, discuss our complex patient, and come up with a personalized plan. What I think sets us apart is that at WVU, we not only providing excellent clinical care, but we are also focused on research and innovation. And I think these cases like this testify to the innovative approach and the patient-centered approach we are able to offer these patients. We have clinical trials and ongoing research to look into innovative and cutting-edge therapies at WVU.
So you don't have to leave the state to get a high level of care.
Yeah, no, I think our team is at par with any institute, and we see patients from all over the country. And at WVU Advanced Endoscopy, we have a center that's in the last few years we have built as nationally reputed. We train advanced endoscopy fellows, we train gastroenterology fellows, but also people from throughout the country and sometimes internationally every month will visit us. They want to see what procedures are, how are we doing these procedures, what programs are we setting up, and the clinical care and the research we are doing at the WVU Advanced Therapeutic Endoscopy program.
And it's right here in our front yard.
Yeah. No, we love our patients here, and we love taking care of them, and we are fortunate that we have a team like this available here.
Okay. So before we go, I just want to ask you, what's the most important thing you want our viewers or listeners to know about the EUS MWA treatment for pancreatic cancer?
Okay. So EUS guided ablation therapies is a new paradigm to the treatment of pancreatic cancer. These are minimally invasive with short recovery time. We can precisely and treat these tumors, burn these tumors with a hope that we can improve the survival for these patients. Definitely more research is needed, and we are working in that area. Hopefully, we can put a good fight against pancreatic cancer, and hopefully our patients can survive much longer.
Excellent. Well, thank you so much for sharing this information with us and giving a lot of patients a lot of hope. I mean, this is exciting. It's a big deal.
Yeah. Thank you, Mary, for having me and talk about this important topic. We are definitely very excited, and hopefully we can reach more patients and help our patients.
All right. Thank you.
Thank you.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about the WVU Cancer Institute, visit wvumedicine.org/cancer. And to find the latest episode of Live Healthy West Virginia, visit our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist. Or search WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Singh and everyone at WVU Medicine, thanks for joining us.